My name is Brooklyn Snyder, and I'm going to be your student nurse today. I'm going to wash my hands, and then we'll get started. Okay, so today we're going to be doing a physical exam on you. We'll be checking your heart, your lungs, your skin, your eyes, your abdomen. Do you have any questions for me?
No.
Okay, do you mind signing this consent that it's okay to video?
Mm-hmm.
Okay. So we're going to get started, and we're going to start with your skin. So I'm going to look at the fronts of her anterior of her arms, and I'm going to look at her arms posteriorly, and then anteriorly, and then posteriorly, and I'm going to look at the front of her legs, and then I'm going to look at the back of her legs, the front and the back of her legs, and then with the backs of my palms, I'm going to assess for temperature. On the backs of her arms. Okay, so while I'm doing this, I have a couple questions for you. Do you know your name?
Lindsay Johnson.
Okay, check that with her wristband. And do you know what today is?
Monday.
Monday, okay. And do you know who the president is?
Donald Trump.
Good job. So my patient is awake, alert, oriented, ×3 to person, place, and time. Her skin is clear without any lesions, no open places. She is a pink color. There's no cyanosis, jaundice, or pallor. And she is warm and dry to touch by palpation. And then I'm going to cover you back up. And we're going to look at your eyes. Yo, go ahead and look at your eyes. So I'll turn the light off. Okay, so if you'll just follow my light, please, ma'am. Very good. Okay, if you'll gaze off this way and just come straight in for me. Thank you, ma'am. Thank you. So my patient is, her eyes are perla. Her pupils are round, reactive to light, accommodation, directly and consensually. And then we're going to check your ears. Okay, so I'm going to pull her pinna up and back. So on her left side, her tympanic membrane is pearly gray, reactive to light, and with a light reflex at the 5 o'clock position. And I'm going to cross over you. And then I'm going to pull her pinna up and back, my otoscope up, and, and her tympanic membrane on her right side is pearly gray. It does react to light, and it is also at the 5 o'clock position. So I'm going to cross back over you one more time. Okay, now I'm going to check your mucous membrane. So if you can open your mouth for me. Okay, and if you can stick out your tongue. And if you can lower your bottom lip for me. So her mucous membranes are pink, moist, intact, no lesions, no drainage. Her teeth are intact. Okay, and we're going to check your mucous membranes. I'm sorry, we're going to check your skin turgor. So I'm pinching by the clavicle. Her skin turgor is brisk in less than 3 seconds. So now I'm going to check her capillary refill. I'm sorry, her skin turgor is brisk. Now I'm checking her capillary refill. And it also is brisk in less than 3 seconds. And then I'm checking capillary refill on her toes. And they are brisk, less than 3 seconds. Then I'm going to check peritibial edema. So I'm going to press down for 5 seconds. No edema noted, so that would be a grade 0 for edema. Then I'm going to feel your radial pulses. Her radial pulses are equal bilateral, and they are at a grade 2. Then I'm going to feel her, once again, dorsal pedalis pulse, and they are equal bilateral and at a grade 2. Okay, then I'm going to check your blood pressure. Your blood pressure is 118/82. Now I'm going to look at your chest here. So I'm looking and I'm watching her take breaths. If you'll take a deep breath for me. So AP is equal, then less to transverse. And then now I'm going to listen to your breath sounds. I'm going to listen to 8 sounds on the front first. So if you'll just take deep breaths for me, and if you have become dizzy or have any problems, just let me know, okay?
Okay.
So I'm going to expose you just a little bit. 1, 2, thank you, 3, 4, 5, 6. Okay, then I'm going to raise your gown. Thank you. And if you'll take one more deep breath for me. And one more. That was 7 and 8. And then I'm going to listen to right laterally. Thank you. And while I'm here, I'm going to fill in the 8th or 9th intercostal space. If you'll take a deep breath for me. So her chest expansion is symmetrical, and her respiration is equal by palpation. Respiratory expansion is equal by palpation. Okay, and then we are going to listen to your heart sounds. So if you'll lay back for me. And with her lung sounds, all of her lobes on the front and the back are, if you'll sit back up for me. I'm sorry. I'm doing too much up and down today. So I'm going to listen to the back of her lungs. So if you'll take a deep breath for me. One more, two, one more, three, one more, 4, 5, 6, 7, 8, 9, 10. So your lungs are clear. Her breath sounds are equal. So in all lobes that are present and clear, there's no rales, ronchi, or wheezes. And that is anterior and posterior. So now if you'll lay back for me and we'll listen to your heart sounds. Sorry for all your up and down today. Okay. Aortic, pulmonic, herbs. I'm going to lift your gown. Tricuspid and mitral. And then mitral is also apical. So I'm going with the bell of my stethoscope, listen for 1 full minute. So once I've listened for 1 full minute, your heart rate is 60. So I'm going to listen again with my bell. Aortic, pulmonic, herbs, tricuspid, mitral, and once again that was my apical pulse that I took for 1 full minute. So with your heart sounds, they are equal, no splitting, no murmurs. S1 and S2 were heard. There were no extra heart sounds, and everything sounded to me pretty normal. So I'm going to check now. So I'm looking for heaves or lifts, and I'll do this for 30 seconds, and I see no heaves or lifts. So while I'm down here, I'm going to expose her abdomen. And then I'm going to check for pulsations or peristalsis, and I do not see any pulsations or peristalsis. So now I'm going to inspect. So while I'm inspecting her skin, I also inspected her chest and her back. They were all pink. There was no lesions, no cyanosis, jaundice, or pallor. So with her abdomen, of course, again, there's no lesions. Her stomach is flat and symmetrical. There's no pulsations, peristalsis. Her umbilicus is midline, no drainage. And there's no lesions or open wounds. So what I'm going to look for next is I'm going to lightly listen. I'm going to listen to your bowel sounds. One, 2, 3, 4. Okay, so bowel sounds were normoactive and present in all 4 quadrants. So now I'm going to lightly palpate. So if you have any pain or tenderness, please let me know. So, excuse me, with light palpation is one-handed in all 4 quadrants. So is there any pain?
No.
No pain, guarding, or tenderness upon light palpation. Now I'm going to go a little bit deeper, okay?
Okay.
And deeper palpation is with 2 hands. Any pain?
No.
So no pain, guarding, or tenderness, no palpable masses, no protruding organs. So your abdomen checked out to be normal, and your bowel sounds were normal, active. Okay, so if you'll sit up, back up for me. Okay, so if you'll stand for me. So if you'll bend forward for me, and I'm looking at her spine, and while I'm inspecting it, again, it is pink, no cyanosis, jaundice, or pallor, no lesions, no open places. So now what I'm looking for here is the curvature of her spine. So there's no scoliosis, kyphosis, or lordosis. So I'm going to palpate. So if you will tell me if this hurts.
No pain.
No pain? Okay, so there was no pain upon or tenderness upon palpation. Her muscles are strong at a grade 5. There is no uneven in her spine or her muscles, so no rigidity. So if you'll sit back down for me. Now if you'll grab my hands, please, as tight as you can grab them. Her grip is strong and they are at a +5. So if you'll push up for me. Now down like a pedal. So her plantar flexion is at a grade 5. Okay, is there any questions for me today? So with your exam today, it was fairly normal. Your eyes, your ears, your mucous membranes, your abdomen, your pulses, all were within normal limits. Your blood pressure was 118/82, so it was normal. Your abdomen, there was no drainage. In your mucous membranes, there was no drainage. Your eyes had perla, which means they reacted to light. There was no fluid on your ears. They were in the correct position. So no more questions?
No.
Okay, thank you so much.